Thank you, sir. Very nicely explained the topic, and I think it's very how you described it. The behavior addiction is quite similar to the addiction to the drugs like alcohol. What I understand about alcohol, what Dr. Vivek Benegal says a lot of times, how it changes lot of things in the brain, permanent changes. Recently, a study was done. I'm not sure how many years back, but I think in last decade only, by I think Vivek Benegal was one of the person in that, and it was it was a cluster study, and many states were few of states of India were included in that. Alcohol was the topic, and it was very clearly given. Message was very clear that alcohol once taken, in 75% people, high chances of getting into harmful use or maybe addiction. So my question from here is whether the problem is watching porn or porn addiction.
Watching porn once in a while is fine. Nothing wrong in that. But continuously watching, it is now science has proven that your gray matter gets shortened. Your frontal lobe gets fired. Okay. And what are you getting out of it? Watching porn gives you what? It describes your personality, that you are always wanting for some false satisfaction. And alcohol, see, there are substance abuse, substance addiction and processes addictions. They're very different. Alcohol comes in the substance addiction. These are processes addictions. Here you don't consume anything. You consume whatever is there in your own body. Your own feelings, your own emotions, your own thoughts. So that is the difference between alcohol and this addiction. These are processes addictions. And these needs to be neurologically, psychologically, biologically and sociologically understood. All four aspects of our life are affected by this. Whereas if you just take alcohol or cigarette or anything, you will be affected your own self, maybe your family. But this affects everything,
Sir, really, just it's an excellent presentation. Just I wanted to know, since history in thousands of, we are seeing Ellora, Ajunta, Khajuraho, from all the places. In fact, the inspiration of this pornography is all the way came from all these things. So we are describing the extremes. So it's a part of sex education, okay, and addiction. So which is that thin line where can say, see, we cannot, even if after discussion all these things, what's so good, what's so bad, what's so, definitely it is a part of sex education. Now at this stage, when it enters that thin line, crosses that thin line to the addiction, and what you can do? This is a question we always get in between our meetings.
Correct, very good. Yeah. This when you see a behavioral change in your child. He's hiding himself, he's hiding his phone, he's not attending his classes, he's asking for more money, he's doing something different than what a normal child should do. These are the signs which and that is the time where you should understand that he's going into the other side of the barrier.
Rather than this is right or wrong, this is a part of sex education. Only binding should be there, ban should be there, easy availability should not be there, age grouping should be isolated, because by any means this porno will not stop.
No, I told you it's a day-to-day management process.
Yeah.
My mother gets porn, videos.
Yeah.
She's 91. We are exposed. We are exposed to every erotic thing which is available. Yeah. Be it billboards, be it internet, be it movies, be it magazines. We are exposed. So we need to take our own decisions. We need to teach our children at as early in their life as possible. You don't have to be shy. We have to come out of those barriers and talk to them properly. So that is the crux. Education is, see, a small child sitting here, 3 months old, okay. A snake goes nearby him. He will hold a snake. He does not know that snake will bite me and I'll get poison and I'll die. But will you do that? You will not do it because you are educated. So that is the difference. And when you educate your children, please understand you are not giving them a consent to have sex or watch porn. You're giving them an option that this is what happens. Let them decide. And next time when he watches porn or does something wrong, he will have that thought that what his father or mother told him.
Thank you, sir.
Sir, excuse me. I'm totally agree with you. And the thing is, sir, Murugan sir, 1 minute. Just 1 minute, one minute. And I got 2 cases. Lastly, cases of 5-year-old girl with a habit of porn watching. She just exposed because of her father's phone. The second thing is, many times in porn watching, when we analyze the patient, we frequently get some psychiatric disorder. Like in many cases, we very regularly we found OCD and sometime in hypomanic episodes. So the thing is, for porn watching, it should be proper evaluation also. And in young patient, when I got, because nowadays mobile is very freely available to all kids. बच्चे मांगते हैं खाने के लिए किसी भी चीजों के लिए. And they are, one is the girls, both are 5-year-old and they are habit of porn watching. So this is very important again. Means age
These
is.
children are vulnerable. You need to counsel them well. You need to tell their parents, put a Blocker X app in their phones at home. They have to be very, very watchful. Very watchful.
Jumani bhai, compliments as usual, your excellent presentation.
Thank you, sir.
Sir,
Bless me.
as you said, this porn-induced erectile dysfunction, the first thing which you mentioned, the delayed ejaculation. Among the 4 problems, delayed ejaculation, that is very common. And it is like a food for thought. One of the patient who is in the early 50s, the man came, I used to have premature ejaculation. After watching porn, I am having delayed ejaculation. So this is a very practical.
So I can't tell patients with delay, tum porn watch karo.
But
no.
आपके इसमें first thing you said कि delayed ejaculation.
Yeah,
Next
it is
was
there.
porn
Definitely
induced.
it is there.
One thing,
It's-
one question. Is there any indication for porn watching for sexual medicine practitioner advice?
Yeah, when we
Any-
give,
when the patient is not able
when
to-
we give office sildenafil test, we do give them some erotic material, but it is only for that time.
That is, when he is not able to
Yeah.
collect the.
Yeah, when we give them for little arousal so that they know whether they're getting erections or no. And that's the only time we have used it, otherwise
there-
not. Otherwise not.
Thank you.
Good evening, sir. So it's excellent presentation.
Thank you very much. Your presentation was also very good.
Thank you. So with your kind permission, I would like to take a bit of stage over here. Addressing, what's your name, sir? Ravi. Ravi's question, na, ki whether watching porn or porn addiction, and your line, sir, ki how do you define education and this thing? So it's a very subtle line, means we are discussing porn addiction, everything, but what sir has covered is the psychiatric or the psychological aspect of it. But what is being left out, and again this is something I speak from my heart, is the ethical and moral aspect of it. Watching porn, what we are not covering is it tends us to objectify things. Like, sir, one of your slides, that was one of a beautiful slide wherein you put in that sequence. Can you get that on again?
Yeah, we objectify our own body, whatever we
sir.
see, that's
Not that
true.
way. So what happens is when you are watching porn, you are actually seeing it, and
This
you
one?
feel this is, no sir, the one, exactly. Watching, embedding ideas and action. Oh, what happens is when we are watching porn, we are embedding ideas. Okay, now who knows what is normal and what is not normal? The younger people, they start seeing this, and it's recently, one of my friends, my schoolmates, he got his son. The son had asked his elder aunt, will you have sex with me closing your eyes? And the family was shocked. Oh, this is a moral and ethical dilemma. Where does it come from? Porn. We sat talking and he's saying that, in the porn videos, you have the family porns. You have stepmothers and stepsisters doing it.
There may be many other issues, Ninad, with that child. He may not be having, he may be having some psychiatric component,
No, that's
illusions, delusions,
Right,
whatever. Now,
it
no
may-
child will say something like that. How many children have told up till now, whatever you said,
We
that
don't,
told you have sex
The
with
problem
me?
here is,
So
we
there
do
is
not-
some psychiatric component always there in these children,
I agree
So we
to-
need to tap that. What we are concerned with is watching constantly again and again and again, that is causing in adults erectile dysfunction, delayed
So the
ejaculations and all
point
those
I'm
things.
making here, sir, is not about that. It's absolutely not about that. I agree to that, and that topic is done and over. What I'm trying to highlight to the audience here is
So that can be kept as another topic, you know.
the moral, yeah. But the moral and ethical dilemmas is something that we have not gotten aware about. And watching porn, to a point, as far as it is about educating myself, about overcoming it, it's okay. But once I start embedding those ideas, I start lowering my barriers when I look at the world around me. Woman objectification as an object of sex, getting those ideas is something that needs to be looked into, and we need to get more aware about. That is something very wrong happening over there. And the second aspect about it is, when do you define that line? Like Sir rightly said, but in psychiatry we keep it as a simple thumb rule, sir. Anything that interferes with your personal, professional or occupational life, it is a problem. So if you're...
What we have learnt in our school is, there's a hairline barrier between sanity and insanity.
Insanity. Agreed.
And we
sir.
normal peoples also cross barriers. So at that time we don't become insane. Right? कितनी बार हम आपस में बोलते हैं क्या पागल जैसे बात करता है? But does that mean वो पागल है? No.
नहीं.
So we all cross barriers. There is no barrier as such. It is only when you see it persistently happening, you know, then even if a man gets erectile dysfunction for 3-4 times, we don't call him a patient unless he gets it for 6 months and it's without any other things, and so those things we have to take into consideration.
Yeah, exactly.
Once in a while, if something happens, that does not mean, you know, even if we don't want to watch porn, we watch porn.
That's...
So many.
Yeah, that's exactly what I'm saying. Ki when it becomes... Yeah. Yeah. So when it is actually something, na, when it becomes a problem, that is when we start. Means anything that interferes, watching porn, once in a while it's okay. I do it, I relax it, it's okay. But when it starts interfering with my life, I have to come here, I'm sitting here, but yet I'm watching a porn over there, then it is a problem. So anything that interferes with your personal, professional and occupational things, then it's wrong. Like Sir said, we have politicians watching porn. Then that politician has a problem, because he is there in the parliament to function, not to watch porn.
So it definitely, watching porn excessively distracts you. You don't remain normal. Your pilot, your captain of your brain, the frontal lobe gets affected. So you don't plan, don't judge, don't, you know, do things which are normal. So this does happen, and this is what it is. That is what we need to correct in our patients, in our children, anywhere whom we find this. So it is definitely a menace. It is not a thing to be said that, okay, you go ahead and watch porn. No. We should definitely avoid, we should definitely defend on these aspects. Yeah.
Just like the making prostitution legalized, there's a debate. So that sort of thing, that there is something called ethical porn. This is that in the porn industry, it is just like prostitution, it is since ages. So ethical pornography is to keep the women's condition, they are abused and all. On this basis, this ethical pornography term is being used. Okay, if you have some more experience, because
so ethical robbery, ethical murder, ethical rape, sab aayega yaar.
Sir, but
what is it?
Sir, they are just
People
trying
can
to
find any damn thing, but we need to be very conscious with our own moral self, What is good, what is bad. God has given us wisdom. We should understand what is right, what is wrong.
Exactly.
And we should make right choices in life. That is what is. Because
Sir,
everything happens to you and me is all because of the choices we made. We are here because we chose to be here. We became doctors, we chose to be a doctor. If anything goes wrong tomorrow at 2 o'clock, somebody calls me up, अरे दांत में दुखता है, अरे तुम डॉक्टर था, तुमने मेडिसिन पढ़ने के टाइम थोड़ी तुमको बोला था पेशेंट तुमको 9 और 5 के बीच में आएगा. And you choose to be a doctor, so face the music. 2 बजे भी कोई उठाएगा, 3 बजे भी कोई उठाएगा. So what's wrong in that? So everything depends upon what you choose. And you need to make right choices, because God, you are the most evolved species on this earth. You have wisdom, so make right choices in life.
Dr.
Ethical
Nandi,
porn, sir.
I'll just Nandi, for your information, breaking news. Sex work, legal. Police cannot interfere. Take criminal action, says the Supreme Court. The Supreme Court has ruled out that the prostitution is a legal profession and sex workers must be treated with the dignity. So for your information. Okay.
Sir, what you were saying, na, ethical porn, if I'm not wrong, it is, it is there. But ethical porn is basically the porn industry trying to tell you that we are not abusing. There is no human trafficking taking place in making these videos. These are people who are doing it voluntarily. Okay, huh. So it's basically about the ethics they follow in the porn industry. That is a different issue. And what another issue is, what ethical dilemmas watching this porn creates within the human society.
No,
And about ethical prostitution, because there was employment involved, there was day-to-day living involved in them. So they had their associations, they put their points across, and brilliant people found out, no, this is their profession. And in our community, in our culture, it has been seen that this was legal. So they allowed. But I don't think so ethical rape or ethical murder will be allowed. थोड़ी कुछ होएगा, ऐसा कुछ नहीं होने वाला है.
Thank you, Dr.
We
Jumani.
need to understand ourselves. Thank you.
Thank you, Dr. Jumani, sir.